Hi, it's Liam from Muscle Doctor, and today we're going to be taking a look at a K-tape technique for the treatment of IT band syndrome. For this, we're going to need some kinesiology tape and also some scissors to cut. I like to pre-cut the tape beforehand, before the client comes. It saves on time and faff, and this is going to be easier to show you exactly how it's done if you're right there. So let's try it. Okay, so you join me here on my forehead, and here we are with the tape. So let's take a look at how we'd pre-cut this. I'm just going to do it on my own leg. I know that the guy coming in is roughly the same size, same build, so we're going to use the thigh and just get a good idea as to what we need to do. We're going to go from the lateral tibial condyle up to somewhere mid-thigh, and we probably want this tape about 3/4 of the length that we actually need it, because we're going to stretch it to that degree. So maybe about there, that should do. And we're going to need 2 strips the same length. So one, you see these are curved, so it's a little bit more difficult to get that exact straight cut, but it does help when we're trimming the corners down. So 2 lengths about the same size. Get yourself some longer, straighter scissors, is my opinion. Okay, and let's fold it up, round those corners off. A lot of what we do with K-tape is designed to try and get this stuff to stay on longer and not come off too soon. Second strip, around those corners, and then when this is done, we're all ready for the client to come in and get straight on with the taping. Okay, so we're here with the patient on the couch, supine and knee flex, because we do want a bit of tension on the ITB there as well. The main aim for this taping technique is that we're trying to buy ourselves some space underneath the skin, somewhere around that lateral femoral condyle. That is where the IT band is going to rub if it gets too tight and it causes pain. The insertion to it is lateral tibial condyle, just around here. So we want to make sure really that we cover lateral femoral condyle and we end up somewhere on the lateral tibial condyle. So let's begin with the first one. We're going to tear the backing tape about 2 inches and then get that bit off. So that's our first anchor, and let's make sure that we can stretch the tape by about 75%. So we're going to start a bit further up the leg, anchor on under 0 stretch, and let's get the rest of that backing tape off. And just leave that last 2 inches on so that we can apply that anchor under 0 stretch. So lateral tibial condyle somewhere around there. Let's get it on nice and straight, no creases, and finish off somewhere around lateral tibial condyle. Make sure that goes on with 0 stretch for the anchor, and then we can use that backing tape to apply a bit of friction to heat the adhesive and to get it to stay on. Like I said, a lot of what we do with K-tape is just in the aim of getting it to stay on and not peel off, which is why we need to make sure there are no creases. Second piece, we're going to do exactly the same thing, but we don't want to just go right over the same line. So we're going to go something like a cross, and the only thing we need to make sure to definitely do here is to cover that lateral femoral condyle, because that's where we want to buy ourselves the space. So we're going to end up somewhere around the head of the fibula. Doesn't matter too much, as long as we're not overlapping exactly and we're going over that lateral femoral condyle. So same process, get the anchor strip off and pop it somewhere level with the first one in the direction of that lateral femoral condyle. Peeling the backing tape, leaving about 2 inches worth of anchor, 75% stretch, covering lateral femoral condyle. Apply that final anchor under 0 stretch. So now make sure no creases, everything's nice and straight, and we give a good amount of friction to heat everything up. So it's going to stay on there, hopefully 3 to 5 days. Just make sure when they're showering and drying that you just dab it, they're not overly vigorous. It will come off when it wants to come off. So there is a K-tape technique for the treatment of IT band syndrome.